Hi, I'm Dr. See Hui Ti, Medical Oncologist, Parkway Cancer Centre, Singapore. We consider a person to be cured of their first cancer if they go for 5 to 10 years in remission. But what is 5 to 10 years? Why such a long interval? For some very highly aggressive cancers, if they do not recur within 5 years, they're really never going to recur. But for some slower growing cancers, we have to wait for 10 years for them not to show up before we declare a patient cured. If a patient is cured, their risk of getting a second cancer isn't very different from a person who doesn't have a history of cancer. It is the same. And therefore, they must continue to do screening for the other cancers and to have a healthy and active lifestyle. On the other hand, some individuals have a higher risk of cancer because the genes are passed from one generation to another, and this is called the familial genetic mutation. Fortunately, this is very rare. It really only affects no more than 2 to 5% of the general population. We see this when families have cancers that are generally at an age group of less than 50. This is rare, but for individuals with genetic mutation, they can have a very high risk of cancers throughout their lives. Therefore, we can find them out and do procedures and surgeries to prevent them from getting the cancer.